Hello everyone, welcome back to Surgery Medical Coding. In this video, I am going to cover an important topic in the surgery medical coding. So, this concept is important not only for coding operative reports correctly but also for the medical coding interview also. So, watch this video until the end to understand the concept very clearly, and we will start now. So, first, while reading any surgery report, first you have to know the key definitions. So, today we are going to discuss about anal excision. So, I will be explaining you first some definitions related to the anorectal surgery. Okay. So, first we will see what is a fissure. Okay. So, what is a fissure? Any idea? So, fissure is actually a tear. Okay, when there is a tear in the anal canal, okay, so we call it as a fissure. So, here you can see this is a fissure. Okay, so here there is a small tear or a crack in the anal canal. Okay, so next we will see fissurectomy. So, what is fissurectomy? Ectomy is removal. Okay, here there is a physician will remove the fissure. Okay, so here there is a tear in the anal canal and the physician is going to perform the removal of the fissure. That we call it as a fissurectomy. Okay, next we have is a sphincterotomy. Okay, so here what the physician is going to do, okay, we will see. So here the muscle is cut. Okay, when the sphincter muscle is cut by the physician, so that there will be reduction in the muscle tension. Okay, then we call it as a sphincterotomy. So here he is making an incision into the sphincter muscle, that we call it as sphincterotomy. Otomy is the incision. Okay, he is making incision into the sphincter muscle, that we called it as a sphincterotomy. Okay, I hope sphincterotomy is clear now. Next we have the hemorrhoid. So what is a hemorrhoid? So we have hemorrhoid when vascular tissue is enlarged or swollen in the anal canal, we call it as a hemorrhoid. Okay, so here the vascular tissue is inflamed. Okay, inflamed or swollen, that forms the hemorrhoid. Okay, swollen vascular tissue is called in the anal canal, we call it as a hemorrhoid. Okay, so we have internal hemorrhoid. Okay, so what is internal hemorrhoid? When the hemorrhoid is present in the anal canal, okay, above the dentate line, we call it as a internal hemorrhoid. Okay, next we have external hemorrhoid. Okay, so when the hemorrhoid is present external, means that is outside the anal canal. So this is important. Outside the anal canal is the external hemorrhoid. Inside the anal canal is the internal hemorrhoid. Next we have is the thrombosed hemorrhoid. So when the hemorrhoid containing a blood clot, we call it as a thrombosed hemorrhoid. So the blood clot is present in the hemorrhoid. Next we have hemorrhoidectomy. So hemorrhoidectomy means ectomy is removal of the hemorrhoid. Okay, so when the physician is performing the removal of the hemorrhoid, we call it as hemorrhoidectomy. Okay, here the hemorrhoidal tissue is excised. Okay, that is the hemorrhoidectomy. Okay, next we have is the hemorrhoid column or groove, which is important. Okay, so you need to be aware of the external, internal, thrombosed, okay, and hemorrhoid column or groove. Okay, so what is hemorrhoid column? Okay, when bundle of hemorrhoids present together, we call it as the hemorrhoid column. Okay, so bundle of hemorrhoidal tissue, we call it as a group or a column. Okay, so a distinct area or a bundle of hemorrhoidal tissue used to determine the extent of hemorrhoidectomy. So, in hemorrhoidectomy, the extent, how many are present, like columns, we will say. Okay, so bundle of hemorrhoids will form a column or a group. Okay, next we have a ligation. Okay, so in ligation, there will be a tying of the tissue. Okay, so there will be a tying of the tissue. So using a suture or a band or another method the physician will use, we call it as ligation. Okay, we have rubber band ligation, for example, where band is tied to the rubber band is tied to the hemorrhoid. Okay, so that blood supply will not be there in that hemorrhoid. Okay, so that we call it as the rubber band ligation, where the blood supply will not be there for that particular hemorrhoid. Okay, next we have a dearterialization. So what is dearterialization? So whatever the blood vessels which are supplying blood to the hemorrhoids, so to that area ligation is done. Okay, that we call it as a dearterialization. So blood supply which blood supply which are supplied to the hemorrhoids are stopped by ligation, that we call it as dearterialization. Okay, next we have is the Doppler guidance. So what is Doppler guidance? Use of Doppler technology to create the blood vessels by detecting the blood flow. So here Doppler technology is used to locate the blood vessels. Okay, so that blood flow can be detected. Okay, next we have is a mucopexy. Pexy means lifting and suturing of the prolapsed rectal or anal mucosa back to its normal position. Okay, here simply prolapsed rectal or anal mucosa here lifting back into the normal position. Okay, that we call it as mucopexy. So here simply lifting the anal mucosa which is prolapsed. Okay, next we have the anal papilla. So what is anal papilla? So these are projections near the anal canal. Okay, so you can see the anal projections near the anal canal, so we call it as the anal papilla. Okay, next we have is the anal skin tag. So in anal skin tag, a benign flap of excess skin around the anus. Okay, you can see a benign flap of excess skin around the anus, we call it as the anal skin tag. Okay, so this completes the key definitions. Okay, without understanding this definitions, you cannot code the operative report. You might be getting confused. So whenever you are coding hemorrhoidal procedures, okay, hemorrhoidectomy CPT codes, first you need to know the definition. Okay, so without knowing these definitions, it will not be easy for you to code an operative report. You must and should know the definitions, and then only you need to read the operative report. Okay, first time you will not be able to understand, second time you will be able to understand, and you can read it very easily. Next, here we have some definitions related to the fistula. Okay, so we will see this also. So anal fistula. So what is anal fistula? So whenever there is an abnormal tract in the anal canal, okay, in the rectum, okay, so this anal abnormal tract will extend from rectum to around the anus. Okay, so simply this is an abnormal tract. Anal fistula means abnormal tract. Okay, so it is connecting from the anal canal to the skin around the anus. Okay, next we have is the fistula tract. So anal fistula will be forming a abnormal passage that is called as a fistula tract. So what is anal fistula? Abnormal tract. So what is fistula tract? It is formed by the anal fistula. Okay, so that will create fistula tract will be created by the anal fistula Okay, it forming an abnormal tunnel. Okay, next we have is the fissulotomy. So what is fissulotomy? So fissulotomy, he will make here an incision. Okay, so here he will make an surgical opening of the fistula tract. Okay, that is the fistulotomy. Next we have fistulectomy. So what is fistulectomy? Whenever he is removing the tissue from the fistula tract, okay, completely, we call it as fistulectomy. So here removal of the fistula is done, that we call it as fistulectomy. Okay, next we have the subcutaneous fistula. In subcutaneous fistula, there will be no muscle involved. Okay, so it is located below the skin, beneath the skin it is present, subcutaneous fistula. Okay, so there is no muscle involvement in the subcutaneous fistula. Okay, so it is beneath the skin. Next we have the intersphincteric fistula. So what is intersphincteric fistula? So it is present between the internal and external anal sphincter muscles. Okay, so this intersphincteric fistula is present between the external and the internal sphincter muscles. Okay, next we have is the transphincteric fistula. So this fistula will pass through, this is important. Okay, this will pass through the both external and internal sphincter muscles. Okay, that we call it as the transphincteric fistula. Next we have is the suprasphincteric fistula. So this fistula will travel upwards, upward above the external sphincter muscle, and then it will descend through the skin. Okay, so here you can see it will extend upward and it will descend through the towards the skin. That we call it as a suprasphincteric fistula. Okay, next we have is the extrasphincteric fistula. So this fistula is from the travel from the rectum to the skin without passing through the anal sphincter complex. So this will travel from the rectum to the skin without passing to the any anal sphincter complex. Okay, that we call it as a extrasphincteric fistula. Next we have is the seton. So here what happens is, here suture material or a thread, it will be passed through the fistula tract. Okay, so here sphincter function is preserved. Okay, sphincter function is preserved. So to treat the fistula, okay, to treat the abnormal tract, what the physician is going to perform is, the physician is going to perform he going to place a thread or a suture material through the fistula tract. Okay, so that he can treat the fistula. Okay, simply seton placement is, he will gonna place a thread so that he can treat the fistula. That you need to remember, simply placing a thread into the fistula so that he can treat the fistula. Next we have is the second stage fistula procedure. So in second stage fistula procedure, so it is a like a, he will perform the fistula treatment in stages. Okay, so that we call it as a second stage fistula. Later operation performed to complete the treatment of a fistula that was intentionally treated in stages. Okay, that we call it as second stage fistula procedure. Next we have is the rectal advancement flap. Okay, so what is rectal advancement flap? Okay, he will take healthy rectal tissue, he will advance to the fistula opening or a surgical defect, that we call it as the rectal advancement flap. Okay, I hope till you are clear. So here simply he is taking the healthy flap tissue and he is advancing to the fistula tract. Okay, internal fistula opening or a surgical defect. We call it as rectal advancement flap. You need to know about some muscles also. Sphincter muscles. So what is sphincter muscle here? It is a circular muscle surrounding the anal canal which helps control bowel movements and continence. Okay, that we call it as a sphincter muscle. So here you can see it is a circular muscle. So it will surround the anal canal and it will help control the bowel movements and continence. Okay, so what is continence? The ability to control the bowel movements and prevent the accidental stool leakage. We call it as the continence. Internal anal sphincter. So what is internal anal sphincter? So involuntary muscle which is not under our control. Okay, so it is the inner muscles and it is for maintaining resting alone anal tone. Okay, so it will maintain the anal tone. Okay, so this we call it as internal anal sphincter. Okay, which is present in so involuntary inner muscle. Next we have the external anal sphincter muscle which is under our control and it will help in control the bowel movements. Next we have is a puborectalis muscle. So a pelvic floor muscle that forms a sling around the rectum. Okay, this will form a sling around the rectum. Okay, so and it maintain the continence. So it is like a V-shaped muscle. Okay, you can see clearly in the Google images also. Okay, so that's the thing. Next we call it, sometimes you can hear in the operative report, prolapse. So what is prolapse? Downward displacement or protrusion of the tissue from its normal position. We call it as a prolapse. Okay, so whenever there is a protrusion of the tissue, we call it from its normal position, we call it as a prolapse. Next we have the rectal mucosa. What is rectal mucosa? When there is an inner lining of the rectum. So inner lining of the rectum, we call it as a rectal mucosa. Next we have is the perianal. So perianal means peri means around. So the surrounding anus, we call it as a perianal. So continence means ability to control the bowel movements and prevent the accidental stool leakage. Okay, that we call it as a continence. Next, the drainage. So allowing the pus or other fluids to leave surgical wound or surgical site, we call it as a drainage. So I hope this is clear. Fistulas are clear and the muscles are clear till here. Next we will move to the CPT codes. So we will see today anal excision CPT codes. I think till now you are aware of some definitions related to the anal excision. Okay, so we have CPT 46200 is for the fissurectomy. So fissurectomy, what we have learned here, the physician is going to perform removal of fissure, okay, including sphincterotomy when performed. So sphincterotomy means he is making an incision into the sphincter muscle. So when if sphincterotomy is performed, it is also included in the fissurectomy CPT code. Okay, so we have CPT 46200 for the fissurectomy. Okay, so we will see step by step procedure for fissurectomy. So he will identify the anal fissure. So what is the anal fissure, guys? So anal fissure will be a tear in the anal canal. Okay, so he will identify the anal fissure. Okay, next, internal sphincter muscles identified by the palpation. Okay, he will identify the internal sphincter muscle. Next, he will make an incision around the fissure. Okay, so whatever, where is the tear, he will identify it and he will make an incision around the fissure, and then after that he will dissect it from the underlying sphincter muscle. So he will identify and he will remove that fissure. Okay, so fissurectomy is done. Okay, that we call it as the fissurectomy, where he is removing the fissure. Next, internal sphincter muscles may also be incised. Okay, so this is not mandatory. Sphincterotomy is not mandatory, but if performed, it is included in the CPT code fissurectomy. Okay, so he will incise the internal sphincter muscle. Okay, so sphincterotomy usually performed laterally away from the fissure. Okay, so sphincterotomy he will perform sidewise, so it is away from the fissure, and then after that incision he will left open and he will allow it to drain. Then you have to report CPT 46200 for fissurectomy. Okay, this is the fissurectomy where he is going to remove the anal fissure, that is the anal tear. Okay, along with that he might perform sphincterotomy, that is the incision into the sphincter muscle. Okay, clear? Next we have a CPT 46221. So what is 46221? Hemorrhoidectomy internal by rubber band ligations. Okay, so here the hemorrhoidectomy. What is hemorrhoidectomy? Here hemorrhoidectomy means he is going to remove the hemorrhoids. So what type of hemorrhoids he is removing? Internal hemorrhoids. So where are the internal hemorrhoids? Within the anal canal. Okay, so hemorrhoids are present within the anal canal. By how he is treating, how he is removing? So he is simply ligating with the rubber band. Earlier we saw a picture, right, where he did rubber band ligation to the hemorrhoid. Okay, for the internal hemorrhoid. Okay, okay, we will see the CPT 46221. Okay, so 46221 you need to report only for the internal hemorrhoid. Okay, when the physician is going to do hemorrhoidectomy for only internal hemorrhoids, that too for rubber band ligation only, you need to report. Okay, he will identify the internal hemorrhoid, he will select for the treatment. So base of the hemorrhoids he will identify and he will apply the rubber band around the base. Okay, and he will cut the blood supply. Okay, whatever blood supply is there he will cut it off. Okay, so hemorrhoidal tissue gradually necrosis or slough off. So the what happens, he will do rubber band ligation. After that there will be a no blood supply and it will become gradually necrosis and it slough off. Okay, that in that case we can report CPT 46221 for the internal hemorrhoid by rubber band ligation. Is it clear now? I think it is clear. We will move to the next slide. So 46945. Okay, so 46945 and 46946 we will see. So hemorrhoidectomy, so same thing, he will remove the hemorrhoids. So what type of hemorrhoids he is going to remove? So he is removing here internal hemorrhoids. So internal hemorrhoids by ligation only. Okay, by ligation only, but earlier he used rubber band, but right now he is using other than rubber band. Okay, so other than rubber bands if he is using, in that case we will code 46945 to 46946. So here he is saying single hemorrhoid column or group without imaging guidance. Okay, so without imaging guidance he is saying. Okay, so hemorrhoidectomy internal he is saying, but he is not using any rubber band. He is saying that single hemorrhoid column or group, but without imaging guidance we can code 46945. Okay, so 46946 when we will code two or more hemorrhoid columns or groups without imaging guidance. Okay, so two or more hemorrhoid columns or groups without imaging guidance. Okay, so here the hemorrhoids are internal hemorrhoids he is identifying. Next, hemorrhoid columns or groups he will identify. So ligation he will not perform with the rubber bands. Without rubber bands, other than rubber bands, we can report this CPT code. For example, he will ligate with other materials like suture if he is using, and if he is ligating. In that case, we can code 469452 to 46946 CPT codes. So that's how, other than rubber bands, you we need to code. Okay, for single column or group you can report CPT 46945. Two or more columns or groups you can report 46946. So here key point thing is the imaging guidance is not used here. Okay, so that's how you need to report hemorrhoidectomy by internal ligation other than the rubber band. That too you need to check for the columns, how many number of columns are involved, whether single column involved or two columns or groups involved. Okay, I hope you understood the internal hemorrhoids by other than ligation. We will move to the next slide. So 46948. So 46948 is for the hemorrhoidectomy. Okay, he is removing the hemorrhoids. What type of hemorrhoids? Internal hemorrhoids by transanal hemorrhoidal dearterialization. This is the keyword here. Two or more hemorrhoid columns or groups, including the ultrasound guidance with the mucopexy when performed. So mucopexy is not mandatory. Okay. So here what he is going to do? He is removing the hemorrhoids. That two internal types of hemorrhoids he is removing. Okay. By how he is removing? By transanal only, but dearterialization. Do you remember dearterialization? Earlier we discussed. So what is dearterialization? Here he is stopping the blood supply of the arteries which are supplying the blood to the hemorrhoids. Okay, so that we call it as a dearterialization. Okay, so here the hemorrhoids are identified. So two or more hemorrhoid columns or groups. So he will insert a proctoscope. Okay, so he will insert a proctoscope. Okay, so along with that he will use Doppler transducer. Okay, so he will identify the hemorrhoidal arteries. So with how he will identify? Using the Doppler guidance, he will identify the hemorrhoidal arteries. So he will select the arteries, ligate with the absorbable sutures. Okay, so simply what he is using? He is using the proctoscope along with the transducer. He is identifying the hemorrhoidal arteries with the help of Doppler guidance, and he is selecting some arteries. Okay, and suturing it. So blood supply to the hemorrhoids will be interrupted. So after suturing, there will be no blood supply to the arteries which supply the blood to the hemorrhoids. Okay, so if mucosal prolapse is present, so he might perform mucopexy. Okay, so he will perform mucopexy, and so if there is a mucosal prolapse. Okay, so you can report CPT 46948. Okay, so where he is using a Doppler guidance. With the help of Doppler guidance, he is identifying the hemorrhoidal arteries and suturing the arteries, and there will be no blood supply to the arteries. Okay, that's how he is performing the hemorrhoidectomy. Okay, next we will move to the CPT 46220. So 46220. What is 46220? Here he is excising the external papilla or a tag anus. Okay, so here he is removing the external papilla. Okay, so we have seen, right? So there will be a projections near the anal canal. We call it as the external anal papilla. Okay, so he will usually associated with the external edge of the fissure or fistula. Okay, so he will select single lesion selected for the external papilla. Okay, for excision he is going to select one single external papilla. Okay, he is making an incision around the skin tag or a papilla. Okay, so he will dissect the lesion from the underlying sphincter muscle. Okay, he will completely remove that external papilla, and then after that he will close the incision with the sutures. Okay, or partially left open for drainage. Then in that case we will report CPT 46220 for the excision of the single external anal papilla or a skin tag. Okay, I hope you are clear for the excision of external papilla. Okay, next we will move to the next slide. We have CPT 46230. So here he is excising the multiple external papilla or tags from the anus. Okay, so here what he will do, earlier he is excising only one external papilla, but here he is excising multiple external papillae. Okay, single external papilla we have one set of CPT code. For multiple external papillae you can code 46230. Okay, so that's how. So for external papillae or a tag, skin tags, you can report 46230. So associated with anal fissure or fistula. Okay, so multiple lesions are selected for excision, and he is making an incision around each papilla or a skin tag, and he is dissecting from the underlying sphincter muscle, and all the lesions are removed. Okay, and he is closing it with the sutures or partially left open for the drainage. So you can report CPT 46230 for the excision of multiple external anal papilla or skin tag. Okay. Next we have is the excision of the thrombosed hemorrhoid, that is for the external. So what is thrombosed hemorrhoid, guys? So thrombosed hemorrhoid means there will be a blood clot in the hemorrhoid. Okay. In 4630320 we have excision of the thrombosed hemorrhoid where there will be a blood clot in the hemorrhoid. So thrombosed external hemorrhoid he will identify, he will administer anesthesia. Thrombosed external hemorrhoid he will expose, and the entire hemorrhoid is completely excised with the scalpel. Okay, so was the entire hemorrhoid excised? You need to check. Okay, so and the site is closed or left open. Okay, then you need to report CPT 46320. Okay, so 46320 is for the complete evacuation. Okay, evacuation of the external hemorrhoid, thrombosed hemorrhoid. Okay, complete excision of the thrombosed external hemorrhoid, not a just incision and removal of the clot. Okay, so you can report 46320 for the thrombosed external hemorrhoid complete evacuation. Okay, next we have CPT code 46250. So what is 46250? 46250 is hemorrhoidectomy, where he is removing the hemorrhoids, but for the external. Okay, 2 or more columns or groups. Okay, for single column or groups we have different set of CPT. Okay, along with that if he is performing fissurectomy we have other set of CPT. Okay, so for internal and external single column we have other set of CPT. So we will see now 46250 where he is removing the hemorrhoidectomy. He is doing a hemorrhoidectomy for the external 2 or more columns or groups. Okay, so he will identify the external hemorrhoids, incisions he is making around the hemorrhoids, and he is dissecting from the underlying sphincter muscles, and his external hemorrhoids is completely removing, and the incisions with closed with sutures. Okay, that we call it as the external hemorrhoids. Okay, so here he is removing the external hemorrhoids. So he is removing 2 or more columns or groups. Okay, next we have CPT 46255. 46255 is for the hemorrhoidectomy, internal and external, single column or group. Okay, so 46255 is for the when both internal and external hemorrhoids he is removing. Okay, in that case we can code CPT 46255 for single column group. So here he will do both internal and external hemorrhoids. Okay, he will identify and he will explore how many hemorrhoid columns or groups excised you need to check. If it is a single column group, you need to check, and he will make an incision in the rectal mucosa around the hemorrhoids. Hemorrhoids he will dissect from the underlying muscles. Internal and external hemorrhoids both are removed in this case. Okay, so we will report 46255 for both internal and external hemorrhoids when both are removed. That too single column group. Okay, in that case we will report 46255. Okay, next we have CPT 46257. So along with internal and external hemorrhoid single column or group, he will perform fissurectomy. Okay, here single column or group is confirmed and he will dissect the hemorrhoids from sphincter muscles and he will uh, do fissurectomy. So when there is a tear in the anal canal, he will do fissurectomy. Okay, so 46257 for single internal and external hemorrhoid column or group performed along with the fissurectomy. Okay, next we have CPT 46258. So along with the fistulectomy he is doing here, earlier fissurectomy, here he is doing fistulectomy. So did you remember fistulectomy, where he is removing the fistula? Okay, so he will remove the fistula including the fissurectomy. Okay, if fissurectomy he also perform, that is included in the fistulectomy. Okay, so that we have for 46258. So here both he is doing what, internal and external hemorrhoids are confirmed, that too single hemorrhoid column. Okay, and fistula and excuse me, anal fistula he will identify. Okay, so he will perform fistulectomy. Okay, so anal fissure if present, okay, he will excise that also. Okay, in that case you need to report 46258. Okay, so here is removing the fistula along with that fissurectomy if there is any tear. Next we have CPT 46260 for the internal and external hemorrhoidectomy. Okay, so here the difference is two or more columns or groups. So this is the keyword, how many columns are excised you need to check. Okay, so here he is removing the two or more columns or groups. Okay, so in that case you can report 46260. Okay, so that's all. Next we have 46261 with the fissurectomy, same thing. So earlier we saw for one column, right now we are seeing for two or more columns. So here he is going to perform fissurectomy. Okay, next for 46262 he is going to perform the fistulectomy along included fissurectomy also. Okay, so here the keywords you need to know. Okay, then it will be easy for you to identify any procedure. Okay, so two or more hemorrhoid columns, this is the keyword, and he will do uh, fissurectomy. Okay, so in that case you can report 46261 for two or more columns or groups for both internal and external hemorrhoids when he is doing. So 46262 here he is doing fistulectomy. Okay, here both internal and external hemorrhoids, two or more columns or groups he is confirming, and he is doing fistulectomy. Next we have the 46270 is for the surgical treatment of anal fistula, that is fistulectomy or fistulotomy subcutaneous. Okay, we have So here he is treating the anal fistula, that is the abnormal tract. Okay, so how he is treating? First he will assess the fistula. Okay, so subcutaneous anus fistula he will confirm, and skin and subcutaneous over fistular tract he will incise or excise. Okay, even if we do incision or excision, you can code CPT 46270. Even if we simply makes incision, you can code CPT 46270. Or if he is doing fistulectomy, you can code 46270. Okay, so here the incision is left open and allow it to drain. Okay, I hope surgical treatment of anal fistula is clear. Okay, even if he is doing fistulectomy or fistulotomy, subcutaneous level, you can code CPT 46270. Next we have is the 46275 for intersphincteric. Okay, so we will see. So here we fistula location is assessed in relation to sphincter muscle. He will identify the intersphincteric fistula. Okay, so intersphincteric means the fistula will travel between the external and the internal sphincter muscles. Okay, did you remember? So here the skin and the subcu and intersphincter muscle overlying the fistula is incised or excised. Okay, and the fistula tract is open. Fistulotomy or fistulectomy is done. So is external sphincter involved, or portion of the may be safely incised. Okay, so here he is making the incision. Okay, in the external sphincter muscle. Okay, so in that case we can code 46275. So here intersphincteric fistula, that is the passing between the external and the internal. Okay, muscles, it will pass through external and internal. Okay, that we call it as intersphincteric anal fistula. Okay, next we have 46280. So it is for transphincteric, suprasphincteric, extrasphincteric or multiple, including the placement of seton when performed. Okay. So here transphincteric, suprasphincteric, extrasphincteric, multiple, including the placement of the seton. Okay. So first you have to identify here the fistula location in relation to sphincter muscles. So you have to identify the type of fistula. Okay, transphincteric, suprasphincteric, extra or multiple fistulas. Okay, so in that case you can code a CPT 46280. So is external sphincteric muscle involved? If it is yes, only a portion of muscle is incised and seton placement through the remaining tract. If it is yes, then you can code CPT 46280. Okay, whenever there is a treatment of complex or multiple anal fistula treated by fistulotomy or fistulectomy, along with that he is doing seton placement, which is included. Okay, in that case you can code CPT 46280. Okay, so that is the thing. So transphincteric, suprasphincteric, extrasphincteric, multiple fistulas. Okay, he is doing incision. Okay, in that case you can code CPT. Okay, so along with that external sphincter or puborectalis muscle involved, and he is making an incision. Okay, in this muscle area, you can code CPT 46280. Okay, next we have CPT 46285. So here this is for second stage. Okay, earlier we saw, right? So first stage, and intentionally he is performing the procedure in stages. So previous anal fistula surgery is performed in first stage. So will open the fistula tract partially, and he will seton may be present. Okay, and if patient is returning for the second stage procedure. Okay, anal canal he will expose and fistula location he will identify, and then after that remaining fistula tract he will incise fistulotomy or he will do fistulectomy. Okay, so is seton present? Yes, and then he will remove if seton is present. Okay, in that case you can code CPT 46285 for second stage surgical treatment. Okay. Okay, I hope you are clear till here. We will move to the next CPT code 46288 for the closure of the anal fistula with rectal advancement flap. Okay, so here he will identify the anal fistula, he will explore the anal canal, and he will assess the fistula in relation to sphincter muscles, and here he will do fistulectomy. Okay, so he will create the defect after the fistula excision. Okay, so then after that he will place a flap. Okay, so he will advance the flap over the defect area and he will close it. So simply he is closing the anal fistula with the help of the flap. Okay, so in that case you can report CPT 46288. So that's all for today's video. I hope you understood today's topic clear. If you have any doubts or questions, please leave them in the comment section. If you found this video helpful, please like the video, share it with your friends, and subscribe to the Surgery Medical Coding for more surgery medical coding videos. Thank you for watching. Keep learning, keep practicing, and I will see you in the next video. If you are interested in surgery medical coding, you can contact me through the mail, or I will be sharing in a link in the description. I will be contacting you as soon as possible. Thank you. Happy coding.